Disclaimer: this podcast is only for informational purposes and not intended to be substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions that you may have regarding a medical condition and never disregard professional medical advice or delay in seeking it. Hello everyone. Welcome to the very first episode on my podcast, Dr. Lavi's Cup of Coffee, titled Baby on Board. I am Lavi, a fourth year medical student. Get ready for the first dose of clinical case discussion, charge up your neurons, hold up your cup of coffee, and let's get started. A Caucasian mommy comes to your clinic with her 14-month-old baby boy with the chief complaints of dry, scaly, eczematous skin lesions, chiefly in periorificial area and acral area. Can you define what is the periorificial and acral area? Yes, you are right. Periorificial area refers to area around mouth and perineum, basically the nappy area. And the acral area refers to hands, legs, nails, even your ear and nose. Continuing on with the case, these lesions appear when he was 2 months old. Baby was born prematurely, weighing 1.8 kgs at birth, without any perinatal medical history. Breastfed for 1 month and formula fed for 5 months and then weaned off at 6 months. At the age of 10 months, he also experienced superadded bacterial skin infections, which were treated by IV antibiotics and surgical incisions. On examination, skin lesions were dry, scaly, eczematous, and lesions also show E. coli on microbiological examination. Hair was thin with patches of alopecia, eyebrows and eyelashes were fallen. Perionica was present. What is a perionica? Perionica refers to inflammation around the nail folds. So, what do you think is wrong with this baby? Let's move ahead and discuss it further. Lab values. ALP was found to be on the lower limit of the normal, that was 50 units per liter. HIV was non-reactive. Malabsorption excluded by testing for anti-transglutaminase antibodies, which were negative. Can you think of where do we test for anti-transglutaminase antibodies for? Yes, it is used for testing for celiac disease. Beta lactoglobulin was negative. Where do we test for beta lactoglobulin? For cow's milk protein intolerance. Patient zinc, urinary and serum levels were low. That were 23 microgram per deciliter and 11.4 milligram in urine for 24 hours. So what do you think is the most probable diagnosis? So the most probable diagnosis for this case scenario is acrodermatitis enteropathica, which is an autosomal recessive disorder of severe zinc deficiency caused by impaired absorption in the gut due to defects in the intestinal zinc transport protein and mutation in gene SLC39A4 or defect on chromosome number 8. It presents in early infancy with dry, scaly, eczematous skin lesions around the periorificial and acral areas. Moving on from head to toe examination, we encounter alopecia, followed by eye changes like conjunctivitis, blepharitis, photophobia, and in GIT, chronic diarrhea, oral ulcers, loss of taste, and other features include the growth retardation, irritability, delay wound healing, and high chances of superadded bacterial skin infections, which we saw in the case. Same symptoms would also be manifested in a child having any type of zinc deficiency due to any reason. Diagnosis is usually by checking out the zinc levels in serum, urine, and even hair. Although they are not very specific, neither sensitive, and diagnosis is made on the clinical basis, relying upon the history taking, and clinical examination and genetic testing is very rarely used. Treatment. Most clinicians prefer to give zinc supplement, usually 3 to 30 micromoles per kg body weight, plus the antibiotics like penicillins, cephalosporins, or aminoglycosides for treating the superadded secondary bacterial infections. So can you guys think where else can we use zinc for therapeutic purpose? Yes, you are absolutely right. It is used for the treatment of Wilson's disease, as zinc is a competitor for copper, so it will not let copper bind to its receptor and lead to the excretion of copper. Where else can we use it? Yes, in the treatment of diarrhea and also for the treatment of severe acute malnutrition. Okay, guys, Can you think about the differential diagnosis of acrodermatitis enteropathica? These include diaper dermatitis, psoriasis, cutaneous and mucosal candidiasis, epidermolysis bullosa, pediatric atopic dermatitis, bullous disease of childhood, pemphigus vulgaris, bullous pemphigoid, and many more. Alright, why do you think zinc is so important? It is a very important micronutrient and antioxidant to be considered after iron, and it is also part of hundreds of enzymes in our body like ALP, carbonic anhydrase, copper zinc superoxide dismutase. And can you guys make a wild guess about zinc is found abundantly in which organ? It's the prostate gland. What are the sources of zinc? It is predominantly non-vegetarian diet, consisting of meat, fish, eggs, nuts, oyster, and liver. So vegans are at a very high risk for developing zinc deficiency. Because vegan diet is rich in phytates too, which decreases the bioavailability for zinc. Okay guys, can you recall other causes leading to zinc deficiency? It is predominantly found in infants, children, adolescent, pregnant and lactating women. What's the reason? It's basically because of their high dietary requirement and their intake is low. Other causes include severe acute malnutrition due to recurrent and chronic diarrhea. That's why we need to supplement zinc in them. Malabsorption, like celiac disease and cow's milk protein intolerance, also in patients with prolonged IV feeding, and individuals undergone gastric bypass surgeries because zinc is predominantly absorbed in duodenum and jejunum, right? And gastric bypass surgeries involves the removals of large part of stomach and intestine mainly. Zinc deficiency leads to high set of consequences like hypogonadism in adolescents, skeletal abnormalities, especially in the pelvic bones, which can lead to difficult childbirth in females in their later lives. Other consequences in children include poor school performance, anemia, and decreased immunity. We talked a lot about importance of zinc. What about the toxicity? Toxicity leads to nausea, vomiting, excessive salivation, gastric ulcer, pancreatitis, which is very common in welders due to inhalation of zinc oxide fumes. Okay, people, that's all for zinc and acrodermatitis enteropathica. Hope all this made sense, and don't forget to check out some images related to this episode on my Insta and FB page of Dr. Lavi's Cup of Coffee, and follow up the page to get updates regarding the future episodes. Hit the bell icon on YouTube to get updates on the future episode, and like, share, subscribe the channel if you really like the episode, and share with your medico friends too. As it is my very first episode, I would really like to hear from you guys as well on how you felt about this episode and how it can be improved much better in future. And if you have some questions regarding today's episode, you can comment below on the question answer section in Spotify or the comment section in YouTube, and reach out to me on my Insta FB page of Dr. Lavi's Cup of Coffee. Goodbye and happy learning.